everyone. So we are recording the lecture part of the evening. Tonight we're going to be talking about Back to the Future, Psychedelics and Psychiatry. This is, of course, part of our virtual series on psychiatry in the 21st century. Before I introduce our speaker, though, we do have a sponsor for tonight. So Rich Stagnato from PRMS is going to speak briefly.
Hi, thank you. I'm Rich Stagnato with PRMS. For those who don't know, we're a psychiatry designed medical malpractice and risk management insurance program. We're pleased to be a silver partner with the Illinois Psych Society. We've been so for quite some time, so it's great to see everybody again. Basically, we provide malpractice insurance policies, risk management advice, and if needed, claims examiners in-house to help folks go through any kind of issue with the court system or through the state medical boards. Just a couple things I just want to pitch real quick is we're having our own webinar on March 1st. It's about contracts. So we're going to have a health law attorney provide some information about that, kind of informal Q&A kind of session, probably something similar will be going on here, where folks can submit questions live and in advance as well on our website. So I'll put a link in there if that anyone feels like joining on that. And the only other thing I'll mention is we do provide donations if psychiatrists are referred to our insurance program, whether or not they buy the policy. So the referring doctor or other provider can have a donation go to any organization such as Illinois Psych Society, whether or not the policy is purchased. And this month we normally do $50 donations. This month we're doing a campaign, we're doubling it for $100 donations. So if you know anyone who needs insurance, please think about us. Again, thank you very much and have a great meeting.
Thank you, Rich. And so now I'm going to introduce our speaker. So we've got Dr. S.B. Forson with us, who is currently at Mass General. He has a PhD that he obtained in Spain before coming to the U.S. for his psychiatry training, including training in child psych and psycho-oncology. He worked as a faculty member at Rush for 5 years, where he received Teacher of the Year awards 3 times. And then after he left Rush, the award was named after him. At Mass General, he's also received multiple teaching awards. He's published tons of peer-reviewed and non-peer-reviewed works, including some book chapters and books. He's a reviewer for 19 different scientific journals, and he is the founder of the Journal of Humanistic Psychiatry and the podcast El Ultimo Humanista with 20,000 followers. I think I didn't completely mangle the Spanish, hopefully. So if you would, Dr. S.B. Forson is going to speak. If you would, hold questions until the end. We will have plenty of time for Q&A. If you need to say something like during the session, you can put it in the chat, and then I'll be keeping an eye on the chat and moderating for questions later. So if you pop your question in the chat, we'll make sure we try to get to it once we get to the Q&A portion. Without further ado, Dr. S.B. Forson.
Okay, well, thank you for this nice introduction, Joy, and thank you, Abdi, for doing the invitation. Abdi and I met in Boston at MGH Psychedelic Conference. It was the second conference, and he was there, and he was very nice, and exchanged emails, and he said, well, you had to come to Chicago and talk about it, or Illinois and talk about it. I was like, well, Illinois or Chicago is my hometown in America, because I lived there when I was 18. I lived there again, back and forth until I was 24. And then I did a fellowship there in child psychiatry. And then I was an attending at Ross for 5 years. So it's kind of like I've been in Chicago since 18 and on and off. Actually, I'm going back to Chicago in April, and I go back every 3-4 months to see my friends, because I have friends that I call brothers there, and it's very nice because I can recognize some of the names here, like Philippe and Gary and some people that I've met before and worked with. So very, very nice to see you all here, and very nice to be back in Chicago virtually. So today we said Back to the Future, a story of psychedelics, but Back to the Future because I think there's a lot of literature nowadays about psychedelics. There's a lot of people talking about psychedelic psychotherapy, but it's also good to remember some of the things that happened in the past, some of the ontologies, because I think in psychedelic psychotherapy, there's some research algorithms that we practice, and we try to apply that to clinical practice when people take MDMA or psychedelics. And we're trying to learn from that in training. But it's always good to go back to the roots, go back to what's the essence of understanding of what is a psychedelic experience. So, let's talk. Let's go to the next slide, and we'll, throughout the presentation, we'll go elaborating these ideas, and then we can do questions and answers and debate, because I think in the world of psychedelics, it's very important the debate that is going on in society, and approach this from a cultural and sociological perspective as well, and even capitalistic perspective, because this is affecting as well in the way we think about a model of care for psychedelics. But when we think about how we treat somebody with psychedelics, we talk very often about the unconscious mind, and we have a feeling that we still accept the mind theory of the unconscious. Even in neuroscience, we still talk about the unconscious and the conscious mind. And the unconscious mind was brought up to psychiatry through Freud. I mean, it's a philosophical idea that was before Freud, but Freud borrowed some of these ideas of the unconscious mind and brought them to the mainstream psychiatry and psychoanalysis. And Freud brings these ideas we know of the unconscious mind, and then the id, the ego, and the superego mediating these forces, the superego being our, grossly speaking, our society's values, and the id being our instincts or our more natural inborn values, and the ego mediating between two. But this is important because despite we don't acknowledge Freud enough in the field of psychedelic psychiatry nowadays, the truth is we continue to use these terms all the time, like ego disintegration, having an experience of disintegration, like you disintegrate on psychedelics and then you reintegrate. And when we talk about psychotherapy, we talk about integration therapy, which is, your ego when you're in a psychedelic experience. And many people here have had a psychedelic experience, so they have read about psychedelic experiences, but you may feel that your ego, your cohesive self may disintegrate, and then you come back reintegrated. So, but you filter out a lot of the negativity going on. So these concepts are going to be very important if we want to have an ontological theory for the use of psychedelics in psychotherapy. So Stangrof, who was the most, he's the father of psychedelics, you can argue. He was an ego psychoanalyst, and we reuse these theories over and over again: defense mechanisms, challenging emotions, etc. So let's go to the next slide. So as we say here, this is many of you knows about this, but usually in a psychedelic experience, you may be able to retrieve emotions or memories that might relay in your unconscious, but they may still causing some conflict and some anxiety. And you can experience this catharsis, which will come with the alleviation of the neurosis or the anxiety that you were having. And sometimes you may experience, from a psychological viewpoint, you may experience relief from that. And this, nowadays, there's a very popular psychotherapy that we use in psychedelics that is called internal family systems. In a way, they teach it something new and genuine, but it's not much different from these theories that we have from our unconscious, because in internal family systems, as you may know, is a therapy designed by this psychologist called Bruce Schwartz. And he argues that we have it's like family therapy at an individual level. And then you have these traumas that you may be aware of or not aware of. And sometimes it might be generational. That's how they explain it nowadays. But somehow you're not aware of it. And when you're in psychedelics, you can become aware of these traumas. And this is very much related to psychodynamic theory as well. We can go to the next slide. And Carl Jung, you all know Carl Jung, but in psychiatry, unfortunately, we don't study in residency Freud or Jung, and sometimes we learn from when we were in high school and we did a philosophy class and or in art, everybody's talking about Jung or Jacques Lacan. And unless you are a psychoanalyst, nowadays, many of these things are not something that you visit. And it's interesting because for both Jung and Freud, I mean, Freud is the one who started the interpretation of dreams, because at that time, Freud was not using psychedelics, but he thought, well, we can access the unconscious through dreams, and the dreams will be the royal road to the unconscious. And Jung was very interested in dreams as well, but dreams had different ideas, as you know. And he talked about the collective unconscious, which was even more important than our individual unconscious, and the archetypes. And these archetypes are archetypes that were there before we existed. I mean, even before we were born. It's almost like comes from as they would argue at that time, from the Christian tradition, but the Christian tradition actually took the Platonic tradition. So it comes from the Neoplatonism, these ideas of Plato, of the world of ideas. The world of ideas can be similar to the archetypes, and these archetypes form part of our consciousness. They become part of the collective unconscious, and then they become part of our individual consciousness. So these archetypes can be like eternal love, the mother and the son, or the mother and the daughter, the hero, the teacher, and all these form part of our unconscious. But in a psychedelic experience, you can actually see the archetypes. And this is something that Stan Grof, many of you may know or may not know Stan Grof, who wrote the book LSD Psychotherapy, and he's the first person who started doing research with LSD with psychiatric patients. And he was a psychoanalyst, but he was fully aware of Jung and Freud, and he used these models of archetypes. So nowadays, when people teach psychedelic psychotherapy, sometimes they talk about the serpent. Sometimes they use archetypes that are more related to Native American traditions and things like that, but all of them can symbolize something that can be universal. Archetypes are supposed to be universal and not dependent on culture. And this is something that we visit a lot in psychedelic psychotherapy. Somebody's taking ayahuasca and they saw, well, I saw like a goddess, or I saw a serpent, I saw a jaguar. What does it mean? And people, when they do art, they see these figures and these images that come to you. So in a psychedelic psychotherapy model, this will be very different from neuroscience, because in neuroscience, we're trying to understand our individual neurons, how they function based on our education. Archetypes are beyond neuroscience. Archetypes are beyond the physical. Archetypes are these ideas that are almost Platonic, that existed before, even before we existed, even before Homo sapiens. Maybe Neanderthals had archetypes. Maybe before Homo heidelbergensis, these ideas were there. Now, when we teach it in general psychiatry, it's kind of difficult to assimilate, because we're embracing a physicalist model of the mind, in which we are relying on genetics and environment. But this is a theory that when people have had personal experience of psychedelics, this theory starts to make sense. And it's difficult to assimilate if you haven't had a personal experience on psychedelics, but when you have personal experiences, or when a patient has gone through psychedelics, they can understand this a little bit more. For Jung, you had the big self, the ego, the persona, and the shadow. So the ego was a little bit similar to Freud. It was something mediating between the persona and the shadow. So the persona would be more similar to the superego in Freud, which is how we portray ourselves in society. How do we see ourselves? Like, I'm a good guy, I'm a good person, I'm honest, I follow integrity, compassion, and you believe all these things about yourself, and you really believe it, and people give you the positive feedback. So that's how you see yourself as a person in society. We always have like a relatively like overly nice image of ourselves that we actually believe consciously. And the shadow would be actually the things about ourselves that we repress to the unconscious, and we don't really want to show up or even accept in our conscious awareness. So the shadow would be, I cheated many times, maybe I am a cheater. I made when we, for example, you made a mistake, or you take some money or borrow some money and you don't give it back, you say, well, I couldn't. You justify to yourself that there was an ultimate reason that was beyond yourself that you couldn't do it. But the shadow would be like, actually, you took advantage of that person. So you're a person who takes advantage of that person. So all these negative things about yourself that are your true self, your true identity, you repress them to the unconscious. You don't want to see them. You don't want to accept them. But when you're on psychedelics, if you take a good enough dose of psilocybin or LSD, these things are going to pop up. So you're going to see your true self in a way. You're going to see your shadow, and you're going to see your persona, and you're going to see how much you have lied to yourself in a way that you were not even aware of. But then you're going to see that. And sometimes people can have a bad trip here because they say, oh my God, I'm getting too anxious. I cannot take this. But if you're prepared with preparation and with psychotherapy, you might be able to see that. So it's important to navigate these concepts in order to understand what's the psychology behind, because in psychedelics, we don't see in the psychedelic community right now, and there are many ways of approaching psychedelics, and we have psychopharmacologists who are interested in psychedelics just from a clinical trial viewpoint. I want to give this psilocybin or this LSD to 40 patients versus placebo, and I want to see in the Beck depression inventory there's going to be an improvement or not, and I want to mask it with a good placebo. And that's the clinical trial research that many people are trying to do, and they're excited about. But in the psychedelic culture, in the psychedelic community, we pay attention to these transpersonal issues that come from Freud and Jung, and we care about the psychotherapy. We think psychedelics without psychotherapy are potentially harmful. And I say we think, and I look like I'm talking like a cult. I mean, I have personal experiences with psychedelics, and I think it has been really helpful for me to think about these psychological concepts and navigate concepts. So I'm just not embracing the ideas of somebody else. I also talking about my ideas about what would have been helpful for me as a patient if I had taken psychedelics. Giving a drug with somebody who has never had an experience and just being sent home, it would have been potentially harming for myself. So that's why I want to emphasize how important these psychological ideas can be helpful, or at least provide support psychotherapy in these situations. So next. So this is the model of the mind that Jung approached. This is the ontology of Jung. And what he also acknowledged, I mean, Jung in a way brought what we call the big self in capital letters. And the big self, it could be interpreted as God in a way for some people, or just the bigger self, but that's beyond yourself. So for Jung, you have an insightful journey in your life through therapy to find this connection to the big self. The big self is, in a way, can be a mystical, transcendental experience. Carl Jung was translating, this comes from Hinduism, actually, the big self of Jung, but he connected to God. But people who are Hinduist here or familiar with Hinduism, Carl Jung himself started translating manuscripts from Sanskrit into German with a friend, with one of his friends who was fully aware of these languages, and she could translate for him. He talked about this Hinduist big self that we don't know exactly what it is, but we are trying to connect with. And in a way, the big self is everything. It's like a mystical, if there is somebody that has a Hinduist background, maybe they can explain better. But from a Christian background, cultural background, we see that this big self, something that may have been God for many people, but in psychotherapy, we're trying to connect to it transcendentally. So this big self or God image is the most important thing. It's where we are trying to go. It's the nucleus, as you can see in this ontological schema here. And then after the big self, you have the archetypes, and these archetypes are in the collective unconscious. And in a way, we all form part of this collective unconscious, but this collective unconscious existed before we existed and will continue to exist after we die. And then after that, less important is the shadow, which the shadow is between the unconscious and the conscious, because the shadow, sometimes we're not aware of these negative things that we have. And then you have the personal unconscious. And the personal unconscious is the things that we can retrieve with psychotherapy. And then you have the ego mediating between that and overall the persona, which is our conscious awareness. So our conscious awareness is the little part up there, which is like, yeah, I'm a good person. I believe in the good. We have done a good job here. I believe in honesty or whatever. I'm a good coworker. Other coworkers are bad, but I'm doing a good job. You know, like, is your narcissism in a way trying to feel that you're better than everybody else sometimes? So next, we go to next slide. So Albert Hoffman, I mean, psychedelics, just to go back, I don't know how I'm doing with time, but I think we're doing okay. So psychedelics have been used in cultures for probably thousands of years, but we know that in Latin America, the natives were using psychedelics for ceremonies and for rituals. It was not as frequent as many people think. I mean, sometimes it's been portrayed as Native Americans were doing psychedelics every weekend or something like that. But it was not necessarily like that. I mean, we have some narratives from some of the first priest anthropologists, Franciscan brothers from Spain that went there in the 15th, especially in the 16th century, when they describe all the culture. There is one person called Bernardino de Sahagún. He wrote the history of the new continent, or the history of the Indias, as they call at that time. And there are some brief descriptions of native people using psychedelics, but for the most part, what they used was alcohol. So they used to drink chicha, and chicha was a fermented corn that they could use as alcohol, and alcohol was the most recreational thing they would do. And it was punished if you drank too much, or if you show public drunkenness. It could be punished with even with capital murder in some cases. So it's not this idea that the native people were using psychedelics all the time, and then the Spanish Inquisition arrived and they brutally oppressed everything. It's a little bit very simplified. As always, the history is way more complex. And this is something I'm working on, actually. I'm working now on an article to see how much accuracy about the Native Americans of psychedelics use as rituals, and how frequent really was using our resources from those times, from the 16th century. But when psychedelics actually became really mainstream, and also ayahuasca, sorry to finish, was used. But when ayahuasca, for example, like many people believe that ayahuasca was used by everybody, and ayahuasca in most Peruvian ceremonies was used just by the priest. He was the one taking the ayahuasca, and then it was in a form of oracle, was giving some wisdom that the priest had acquired through ayahuasca. But psychedelics became really mainstream in 1938 when Albert Hoffman synthesized LSD, and he experimented with it himself by mistake. And then he got this experience of what people call the bicycle day, where he took LSD and then in nature, and he thought there was potential therapeutic effect on it. And he was in Switzerland at that time, and eventually, I mean, this became like a thing. They started doing the research. It's the time that later on he came to the US, and you have Timothy Leary doing the research here at the Harvard Psychology School with Ram Dass, and then you have the whole movement, the first clinical trials in Alcoholics Anonymous. It was used as well by Bill Wilson and Dr. Bob as a means of transcendence, and we know now that it helps with alcoholism, but people still worry about addiction, which is actually something that helps with addiction, the psychedelics. So, it's good to know the history, because this is when really became mainstream, but then it became forbidden under the Nixon administration. So you can go to the next slide. Stan Grof started in Prague, in Czech Republic, doing LSD psychotherapy, and he published the book LSD Psychotherapy. And he is being coined as the person who came out with the serotonin hypothesis, that these psychedelics in general, LSD and psilocybin, when we talk about psychedelics, they target the serotonin receptor, and the serotonin receptor may have an antidepressant effect. And this is something that has been accepted. I mean, there's consensus that the action, the neuroscientific or pharmacological actions of psilocybin are LSD and DMT as well, and sapo, which is a substance that they obtain from, it's like a DMT-like substance that they obtain from some frogs in Peru or Latin America, or even ayahuasca that has DMT plus an MAOI. That has a serotonergic action, and this serotonin action in the brain, it was probably related to the antidepressant effect. And also, Stan Grof came out with this theory, I mean, of having neonatal experiences. So in his mind, and this is a little controversial, I would say, but everything in psychotherapy and psychedelics can be controversial, but he came with this idea that people could regress not only to childhood experiences, like you would understand in Freudian psychology, like you can recover some childhood experiences. He thought that you could go even beyond 2 years before, where you cannot even have memories. And through psychedelics, you could access fetal and neonatal experiences, and people could regress to the fetal or the neonatal experiences. And that's when they come with the psychological theory of experiencing a rebirth, and people trying to get out of the canal of their mothers and having these traumatic experiences that they may have gone through the experience of being born in this world. And this is something that, you know, for somebody who is naive to psychedelics may sound as a little bit too far away from something we can handle from a psychological viewpoint. But eventually, if you get trained in psychedelic psychiatry or in psychedelic psychotherapy, you will become more and more familiar with these ideas. And another thing that Stan Grof brought to the world of psychedelics, or came out or created for the psychedelic culture, is holotropic breath work. So when psychedelics were banned with the Nixon administration, Stan Grof at that time was working in the United States. He came from Europe to the United States, and he started coming out with the holotropic breath work. And he, through breathing, it's a breathing, like you start hyperventilating. So you had to hyperventilate up to 30 times, and then you expire all the breath, and then you hold it as much as you can, and then you start hyperventilating again. And after a few times you do that, then you can start dissociating and having psychedelic experiences. So this is one of the ways. It's important because when people think about psychedelic culture, they think, oh, this is just taking drugs. Can you get addicted? And actually, you can have psychedelic experiences through meditation and through breathing techniques such as holotropic breath work. So for Stan Grof, you are normally in a holotropic, which is a normal consciousness state. Holo would be like beyond normal consciousness state. So that's how he came out with this of holotropic breath work. So next slide. Yeah, this is another contribution of Stan Grof to the world of psychedelics, is what we call the cartography model of the mind. So in this cartography model of the mind, for him, this is very interesting because this goes beyond Freud and Jung. He takes it to a much higher level. So in our consciousness, you have the abstract and the aesthetic, what you see above in the picture, the thoughts and the perceptions. So this is me and you sharing our thoughts, our perceptions, our feel for art, our feel for, is it good that we're bringing psychedelics? Is it bad that we're bringing psychedelics? Our ethical questions. Fine, this is the world we live in. But then we go to the personal, and you have our psychodynamic experiences, our memories of our childhood, our memories beyond our childhood that might be unconscious as well. All these things that is psychodynamic, that can be unconscious. Some things we might be able to retrieve to consciousness. And this is our psychodynamic experiences, our psychodynamic life. Below that, you have the perinatal experiences. So he took psychoanalysis to a deeper level. Perinatal experiences are important. Our birth memories or our uteral memories. So he would argue that we could have fetal memories, and these fetal memories can be retrieved. And this, in internal family systems, they have been able to integrate it too, because people, I would say in internal family systems now, they go to a higher level, that you talk to generational trauma, like the trauma of slavery or the trauma of genocide. And this is something that you had to work on, even if you were not born at that time. So this has gone even deeper, even nowadays. And then you get the transpersonal. Transpersonal means beyond the person, beyond ego, beyond time, and beyond space. You know, this can be transpersonal, transcendental. And this is something that, I mean, you could argue the archetypes could be there too, but it's beyond us. You know, it's just a collective thing. Okay, so let's go to the next slide. I don't know if I'm explaining all these philosophical, psychological theories, but I think that's the way I can contribute, just by providing some ontological, philosophical thought into this, so that people say this is not just taken, because everybody knows there are clinical trials with psychedelics. Everybody knows psychedelics are at least as effective as antidepressants to treat depression. We all know that. We have been bombarded with this in the science news and the newspapers, but here we can take it to a deeper level of understanding what we are trying to communicate when we talk, we want to give psychedelics. And this actually very impacted in the art as well. And I like to bring the cultural aspects, but the unconscious mind was very important in art. All the contemporary art is very impacted by Freudian theory. And even Dali was trying to portray here, as we see in Salvador Dali, we can see the drawers that are the unconscious, and we can access the unconscious in the drawers. Surrealism is a movement that started in France in poetry with André Breton, but very soon started impacting the arts. So, and all the art nowadays, all the contemporary art, which is a way that can be therapeutic for us when we take psychedelics, sometimes instead of taking notes to bring to therapy, we draw and we do art, and then we can use this art in therapy as well. Okay, next. We have Miro as well, this the one that used the unconscious method to paint. He painted in the unconscious way, and he's the one who really portrayed this dynamic unconscious therapy movement. Next. I'm a little biased for Spaniards, but sorry. We have Jackson Pollock, which he brought he was impacted by surrealism, but he took it to a higher level by saying, I'm just gonna enter an unconscious state, and a psychoanalytic unconscious state, but he called it automata. And in automata, he would start representing his emotions by dripping paint. And this is the whole idea of Jackson Pollock art as well. Next. And then from there, we go to psychedelic art. And in psychedelics, we know we start with psychedelic psychotherapy, psycholytic psychotherapy, but in art, we had the first representations of psychedelic experiences, where we have the kaleidoscopic images or images of life and death. We can go to next. So it started with rock posters primarily, but we can see this distortion of the world, distorted images of the world. Next. Yeah, also albums. I mean, it's my favorite, one of my favorite albums, but yeah, next. Yeah, so, I mean, you know, let's talk a little bit about the clinical trials, but from the 1940s to the 1970s, we have a lot of research. Initially, this research was down to, initially they thought it could be good for psychosis. That was one of the first ideas, but all the research with psychosis, so that it was not helpful for psychosis, that people with schizophrenia wouldn't get better taking psychedelics. So then they thought, and this was throwing shots in the dark. They said, well, let's use it for neurosis. Neurosis is what we call now depression and anxiety. So they found that it was actually helpful for neurosis. They found that it could be helpful for, I mean, they tried it for everything pretty much, but they found it was helpful for alcohol. They found it could be helpful for ketamine, which is another psychedelic, could be helpful for withdrawal experiences as well. So we have a lot of research there until the 70s. But then in the 90s, when Rick Strassman started doing research again with psychedelics, DMT, we started having a lot of literature. But the first trials were very small. They were pilot studies, but they were well done using the methodologies that we do now. So the first trials were randomized clinical trials. Most of these trials were crossover. So you get like 16 patients and you give the 16 patients the LSD or the psilocybin, and then they work as placebo. So 8 get the treatment, 8 get placebo, and then they cross taper to the other side. and 8 get the treatment, 8 get placebo. So it's very, very small studies. The first studies, they were used with patients who had cancer for anxiety related to cancer, and they were like safety studies, but they found that anxiety related to cancer would get better. So this is some of the first studies that came out with Charles Groff and people that you're in the field, Then later on, we have other studies with Griffins and Cahar Harris, and many of you may know Cahar Harris because he's very popular psychologist who started doing the research with the neuroscience effects of psychedelics, like functional MRIs and psychedelics. But also he's been doing involved in a number of clinical trials for depression that is hard to treat. He's one of the first studies with 12 patients with depression, what they call treatment-resistant depression. I don't like the term treatment-resistant depression. Some people use it clinically. You don't want to tell a patient you have treatment-resistant depression. Maybe you want to say you have the depression that is difficult to treat. It would be a little bit better. But they did for these patients, and they found with only one dose of psilocybin going to response, and sometimes with 2 doses, complete remission. And this could last for 6 months. So this actually, for people who are not interested in psychedelic culture and psychedelic thought, this is actually the most interesting aspect of psychedelics. They say, okay, I can give a patient one drug like escitalopram or fluoxetine daily for a month, and then they had to take it daily for 6 months. Or I can give one patient 1 dose or 2 doses of one medicine, and then the patient, I don't have to give them anything else for 6 months. So this sounds better than the SSRI. The study with that was led by Robin Cahar Harris that was published at New England Journal of Medicine, they saw that it was equally effective to escitalopram. So in the psychedelic world, people thought, oh, bummer. I thought it was going to be much better than the SSRI, because in my experience, it has been much better than the SSRI. But at least it's equally effective than the SSRI. And that was very good, actually, because some people were surprised that the psychedelic, like psilocybin or mushrooms or LSD, could be equally effective than SSRI. They couldn't believe it. So I think it was a draw, but in a way it was a good draw, because we know now.
Okay, Google, stop.
I'm sorry? Okay.
I think someone was unmuted accidentally.
Oh, okay. Sorry. How much time do we have left for the 45 minutes?
Sorry, I thought I'd unmuted. We've got about another 50 minutes before we have to be completely wrapped up.
Completely wrap up. Okay. Yeah. Okay. Yeah. I can go long or short. But let me know when it's time to start the questions in case I go over. So in this, I get very passionate, so I can talk for hours about this. But the study that most of you probably know is the study of New England Journal of Medicine that came out last year. What we have from this study is like, okay, they are equally effective, escitalopram and psilocybin. So some people didn't like it, some people got surprised. For me, it was good news, because at least they are as good. And actually, they are as good, and people who didn't care about psychedelics, now they are paying attention to it, because they are like 6 months of one pill every day versus 2 sessions. That sounds good to me, and this is something I can offer to the patients. So this is something to think about. Another thing of that study is that the quality of life was better for psychedelics than for SSRI. And I don't know what's the difference between depression and quality of life, because for depression, we have this consensus about what is depression, what is not depression. But if you have a decrease on your quality of life, it's something I should care about. Even if my depression is better, if I have less quality of life, I would rather actually take something that brings me more feeling of quality of life. So this is something also to point out from that study. So we can go to next. It's been tried for tobacco use disorder, open label, but for OCD, DMT, ibogaine, that you may know these substances, but ibogaine is another psychedelic that comes from the iboga plant in Africa, and it's been very successful for decades. And now we see it's helpful for alcohol use disorder, for opioid use disorder. So psychedelics could be addictive. I don't know. I don't have any patient that I'm treating for psychedelic addiction. I've seen patients who struggle with substances in general, and they really enjoy psychedelics, and they say they can be my drug of choice sometimes, but I've never seen withdrawal. I've never seen excessive use. I've never had a patient that came for sole psychedelic use disorder. I've never seen that. I've never had a patient with hallucinogen use disorder. That is something that is in DSM, and we had to be careful because some patients may have it. I have never seen it. I have never seen an accurate case of it. But some people feel it, and these are phenomenological experiences that we had to be aware of. But this, because it was classified as a controlled substance, we automatically assume that hallucinogens are addictive. And if anything, I would say maybe you can misuse them, but for addiction or the dependence or whatever we call it nowadays, is actually can have a beneficial viewpoint. And I have patients who tell me, I have opioid use disorder, I have alcohol use disorder, and I take LSD a lot. But LSD is not like alcohol and heroin. LSD is something that helps me actually figure out my mind and maybe have a better understanding of my alcohol problem, and actually it's made me more inclined to want to drink less. So, and sometimes we put everything in the same basket, but it's not necessarily something that should go in the same basket, and we had to go case by case. So what is the psychedelic experience? So we know there are clinical trials that helps depression, and we know that with guidance and psychedelic assisted psychotherapy and having a guide there that can facilitate the experience is probably better and less harmful. But what is the experience? So many of us have had the experience. Probably, I would argue, I mean, nobody has to volunteer, but I would argue maybe about half of the people who are attending this lecture have had a psychedelic experience themselves, because this is very popular nowadays. But in general, the phenomenology of the psychedelic experiences are having geometric shapes. We call it synesthesias as well, because these geometric shapes, and I'm generalizing the psilocybin experience, but these geometric shapes can vary with the music that you're using, because ideally we're using this covering our eyes and listening to music. You can have feelings of love and empathy. It's a little bit different for psilocybin, LSD, as compared to MDMA, which is not technically a psychedelic, but we put it in the same basket as well. In MDMA, which is ecstasy or Molly, the street name that people use, you can feel empathy for the people around you. But with psilocybin or LSD, you may feel empathy for the world, empathy for humanity, empathy for nature, empathy for the animal. So it's a different kind of feeling of empathy feeling from a phenomenological point of view. You can have a feeling of being interconnected, like everything is connected to everything. Everything is connected to, like, nature. We are part of nature. Nature is part of us. And this is not about me versus nature. I am just nature. And you can see that. You can even look, if you're in nature, and sometimes, this is recommended to do it in nature, but in research or in clinical practice, we cannot do it in nature. But you may feel that you're connected to the trees, to the grass, to the animals, to the birds, to the planets, if you're at night, to the stars, because we are stardust. I mean, the truth is we are nature, but sometimes as humans, we have this view that we are not nature, that we as humans, and we control nature. So you regress to that. You regress to an understanding that you are nature. You can have a feeling of reset, like it's like starting over. Sometimes it's like time to reset. Like you take the psilocybin and you disintegrate and you come back, but you come back as filtering out the negativity. You can have a deconstruction of things that you were holding as true, or you were holding as important. Emails from your coworkers don't make any sense. Professionalism, things like we care in our daily life, in our neurotic life, like, oh, I hope they don't get mad at me because maybe I shouldn't have sent that email to everybody. Those things, oh, maybe we have to be nice to each other. You start deconstructing all that in a way that it sounds hilarious or funny to you, thinking, oh my God, I can't believe like we give so much importance to these things that are just neuroses. All we have is love and empathy for each other. We should just care for each other. So these are normal feelings that we have when you take a higher dose of psilocybin that can be like 3 and 4 grams of mushrooms, or you take in capsules, you had to calculate the equivalent of that. High entropy, feeling that everything is deconstructed, that you don't know who you are. Sometimes you may lose awareness of being alive or dead, and this can be very healing in a way. And feelings that we have no language to express with. Even an ego death, thinking that you have died. I had myself one experience like that one time, that I thought I was dying or I was dead. And then you come back, but you come back as a new person, as completely filtered new person, where you feel that now positivity is with you, peace of mind is with you. And that, in a way, it changes you forever. I mean, I always say, you don't have to do, I mean, some people who have depression, and you take it for depression, some people may want to take it every 3-6 months to prevent relapse in depression. And we don't have a model for long-term treatment with this. But if you take it for personal growth, and this is something that is, again, we are going off our understanding of clinical psychiatry. In clinical psychiatry, we don't do positive psychiatry. Despite we talk that we should bring positive psychiatry, our clinical psychiatry is negative psychiatry. We are treating negative symptoms. We are treating depression. We are treating anxiety. We are treating things that shouldn't be there, you know? Where positive psychiatry would say, we are improving, we are getting better, we want to grow as a person. And this in psychotherapy is very important. In psychotherapy, we don't go to therapy when we are depressed. I have a therapist, I go to therapy and I'm not depressed. I go to therapy to keep psychological health. I go to the gym to keep physical health. I take psychedelics to keep psychological health. And this is a positive psychiatry viewpoint. And, you know, and I'm not saying that in positive psychiatry they are talking about psychedelics, but I think we should talk positively, because for psychedelics, we can bring this dimension of, like, I take psychedelics, I had a psychedelic experience, I learn about myself, and maybe I don't need to take psychedelics again in my life. Maybe I did the work and I'm going to leave it there for me to sit there. I will revisit maybe in 20 years. I may not revisit in 20 years. So these are new ideas that go beyond our regular ideas of clinical psychiatry. Okay, so next slide. We have neuroimaging experiences, as you see, where you have, like, in general, activation. We had the ball technique. I mean, you had several techniques, but we have activation, more activation, obviously, in the visual cortex as well. So next. And then psychedelic psychotherapy is really the key. I mean, that's why we call it psychedelic assisted psychotherapy. So I know psychedelics really are like catalyzers of an experience that was there with you, but you couldn't see it. It was something that was real. It was part of reality. When people take psychedelics, they say, that's reality is more real than this reality. And I want to be in that reality better, but I just couldn't see it before. The psychedelic is helping me doing it. But actually, you can access it through meditation, through philosophizing, through insight in your life. You can access that reality too. So that's why we say psychedelics definitely are going to help you. But the important thing, the life-changing thing, is the psychotherapy. If you take LSD, excuse me, to wrap up. Yeah, I'm almost wrapping up. Yeah. So if you think about it, this integration psychotherapy is what really going to help you have an understanding that you can keep with yourself. If you take LSD or psilocybin and you mix it with MDMA and cocaine, sure, you're going to say it was fun, it was cool, but you may forget about it. With the psychotherapy is where you're going to keep it with yourself, hopefully for the rest of your life. And you have a new sense of improvement of the anxiety and depression that we all have, because we all have, when you say you have depression, I can never tell a person with depression versus a person without depression. I mean, I can tell people who are very depressed, but who doesn't have anxiety and depression nowadays in this neurosis that we all deal with? The improvement of those symptoms, appreciation of beauty and nature, an enhanced sense of empathy towards humanity, a reset, new science and new understandings. I would say when you take the psychedelics for the first few weeks, I wouldn't make big decisions in your life for a week or two. I would wait until later, where you start actually having processing and understanding, because you can be very suggestible during that time. And the integration is the important part. We can go to next slide, which I think is last. But okay, yeah. So this is my email. If anybody wants to reach out, I didn't talk a lot about ketamine, but I will say I've been doing primarily work with ketamine now, especially at the inpatient psychiatry unit. And this is, I think, is really important because inpatient psychiatry unit, half of my patients come for psychosis, half of the patients come for suicidal thoughts. And ketamine is the only treatment that actually helps suicidality and suicidal behavior. And we're having a hard time implementing it in inpatient psychiatry units because of resistance from the administration to do intramuscular or IV ketamine. And in inpatient psychiatry units, we don't do IVs, which I think is, let's put the ketamine clinic in the hospital and maybe we can send them there, but not having an IV in an inpatient psychiatry unit, it's kind of like a little funny for me that we cannot do that. But at least we could try to do IM and monitoring of blood pressure. And there is a lot of resistance of ketamine in hospitals. And in ketamine, it's a little bit different because in ketamine, when you take a high dose of ketamine, the patient goes to sleep in a way, so you cannot be facilitating like you would do, but you can do the integration after. And something that I have found very helpful is to reread the books about dream interpretation and read about dreams in general. And I think in ketamine, you go through these dreams that if the patient write notes about it, they may not forget the dream experiences. And this is something that they can talk about. This is something I will be presenting at the American Psychiatric Association annual meeting about dream interpretations on ketamine. So this is this is the end of it. So I'm happy to answer. Or well, let's just start learn. I mean, what we do with this is we learn from each other pretty much. So yeah.
Well, so I haven't seen any questions pop up while you've been speaking. So while we're waiting for people to either raise their hands or put something else in the chat, we do have some questions from when people registered. You kind